Hair loss is one of the most common problems worldwide. It affects 70% of men and 40% of women. We can say, it is affecting 1/3 of the population. It is normal for hair to fall off after it has finished its growth cycle. Hair growth cycle is in 3 stages, that is, from its anagen stage to catagen and lastly, telogen stage. Everyone loses about 50 to 100 hair strands each day. After it falls off, a new hair starts all over again. Each hair strand takes about 3 to 5 years to complete its growth stages. Normally we have about 100,000 hair strands on our scalp, and losing 50 to 100 hair strands is visible enough. But if you start noticing so much hair strands on your brush or comb after combing your hair, then you should be losing executive hairs. Or, if you start noticing bald spots or thinning hair strands, then it might probably mean you are losing much hair than normal and which are not growing normally again. Are you wondering what might be the cause of hair loss? Now I'm going to explain to you all possible causes of hair loss. The most common cause of hair loss is hereditary. This affects both male and female. If you come from a family lineage where members in your family have baldness or pattern hair baldness for both male and females, you might probably have to suffer from hair loss as well. It means that you've inherited genes that cause your hair follicles to shrink and eventually stop growing hair. There are many other causes of hair loss. Aging also causes hair loss. With age, most people notice some hair loss because hair growth slows. At some point, hair follicles stop growing hair, which causes the hair on our scalp to thin. Hair also starts to lose its color. Alopecia areata causes hair loss. Alopecia areata is a disease that develops when the body's immune system attacks hair follicles, causing hair loss. You can lose hair anywhere on your body, including your scalp, inside your nose, and in your ears. Some people lose their eyelashes or eyebrows also. If you are receiving cancer treatment, you will be likely to experience hair loss. Especially, if you receive chemotherapy or have radiation treatment to your head or neck, you may lose all or most of your hair within a few weeks of starting treatment. Childbirth, illness, or other stresses may cause hair loss. A few months after giving birth, recovering from an illness, or having an operation, you may notice a lot more hairs in your brush or on your pillow. This can also happen after a stressful time in your life, for example, if you have divorce, or you have lost your loved one. Hair care causes hair loss over time. If you color, perm, or relax your hair, you could be damaging your hair. Over time, this damage can lead to hair loss. Hairstyling can cause hair loss over time. Hairstyles such as braids causes your hair to be so much tension. Scalp infection causes hair loss. A scalp infection can lead to scaly and sometimes inflamed areas on your scalp. You may see what look like small black dots on your scalp. These are actually stubs of hair. Some people develop a bald spot. Side effects of some medication causes hair loss. If you think a medication is causing your hair to loss, ask the doctor who prescribed it if hair loss is a possible side effect. It's essential that you do not stop taking the medication before talking with your doctor. Abruptly stopping some medications can cause serious health problems. Infections like sexually transmitted infections, if left untreated, can cause hair loss. A sexually transmitted infection like syphilis is such an STI. Left untreated, syphilis can cause patchy hair loss on the scalp, eyebrows, beard, and elsewhere. Other STIs can also cause hair loss. Thyroid disease causes hair loss. If you have a problem with your thyroid, you may see your hair getting thinner. Some people notice that their hair comes out in clumps when they brush it.
In this channel, we are focusing on health, beauty, and fashion. Like we rightly say, looking good is good business. If you are new to this channel, click on the subscribe button below, so that you don't get to miss our updates. You can also follow us on Instagram, Facebook, Twitter, LinkedIn, TikTok, Snapchat and many others. We bring to you all what it takes to look good. Once again, looking good is good business.